it is nice to know that many senior professionals are giving their positive feedback, especially on the academy regularly for the free webinars what we are conducting. This is free webinar number 170. It's not just what is called as these webinars are for counting the numbers, but if you see that these webinars have made every day during this lockdown, right from the first lockdown which started in 2020 till date, it made every day count for knowledge. Without no reason, don't think that AOMPT number of followers is the leading in the world in the Facebook. Whole world's largest academy, number of followers. In the same way, the number of videos what we shared in Instagram and also in Facebook. It's not just the professional community which sees these videos. Some may be interactive videos like question and answers. Some may be people don't ask any question at all. And I am contributing my perspective across various points. A people or a public who is watching these videos might be a patient, might be what is called as a relative or a parent of a physiotherapy student, might be an industrialist or a politician or a policy maker. There is so much of opportunities that everybody can watch these videos. This is the access opportunity. So that means the opportunity for everyone to access that the online platform provides. Is it not the responsibility of every physical therapist to ensure that this should be done at their own level? Because you are not for patients who are just entering your clinic. You are for patients, community, global, at large. The best example is, you can't say patient who is coming inside your clinic only you will do the treatment. If you are walking on the road and you find someone had an emergency and they are collapsing on the road, also you have to give the treatment. You are traveling in the flight and a passenger is having an emergency. The flight crew needs a medical assistance and they are announcing, are there any medical knowledge persons are there, can you help them? You will be just sitting and looking down. Why to go and help? That means you are not at all a qualified professional. Not only just a qualified professional, you are not a human being at all. Because you should ensure that even if you are not qualified also you should help the others, those who are suffering. That is a moral responsibility of being a human being. Even animals help each other. You see what happens when a dog has died, what other dogs do around. When a cow has died, what the other cows do around. Every animal takes care of the other animal. They are not taking care of only their family. They will always bother about the other animal. Human beings have that moral responsibility. So go beyond your local circle. If you are a teacher means think beyond the college. If you are a clinical physiotherapist means think beyond the department. Think beyond the clinic. If you are a researcher, you are writing a textbook or you have published an article means think beyond your research group. 5 people you have teamed up and you have published an article. It is not that this is the structure and this 5 people only I will be co-author. That means you are actually abusing the value of science. because science is something which is global. Same way healthcare is also global. Education is also global. There's nothing that is actually stopped by country, religion, race, gender, any kind of discrimination for all the three. So it is the responsibility of every professional to understand that why we need to have an online presence. Online presence does not mean that you are having an Instagram profile or you have what is called as a Twitter profile to share the news alone. Online presence is for healthcare. You are a healthcare professional. Something or the other related to physiotherapy you should be posting every day. I am telling every day. I know it is very tough. Hardly the posting one physiotherapy related post or a health related post every day. I know it takes 30 seconds. And 30 seconds is very tough. You don't have time for the 30 seconds. Okay? And putting a video. 15 minutes video. Yeah, 15 minutes, how it is possible? 24 hours are there, but 15 minutes, it's impossible to put a video and all. To record that video, it takes maybe 15 minutes. And to upload that, maybe it takes half an hour if it is very slow internet. It is anyway automatically going on. You just upload it and you just do your work. You can come back and see it is uploaded. Maybe into the YouTube channel, or it is Facebook, or even if it's the Instagram. The next thought that is there is gender. I am a girl. How can I put videos? If not video, at least put audio. Who's telling you not to do? Just educationally you talk, share your knowledge. Excuses will be there for people who do not want to do the things. Purpose will be there for people who want to do the things. What is your purpose as a healthcare provider? Keep yourself reminded. That is your duty. As a human being, your duty is there. Next, of course, you have a higher level of duty to take care of other patients, other people. So that is where you are getting more obligation that you should do something for the other people. You are a teacher means double responsibility. You can treat the patient also. You have to make your student to treat the patient also. That means you cannot just sit with morning to evening and Monday to Saturday. If you are doing that, you will be nominated for the most selfish physio award. And also remember one thing. What is the real award? I am talking because I got around 75 awards. You want to count mathematics, okay? Countless number of awards are there. But point here is, people are celebrating that I got an award. Thank you, this person giving me this award. First thing is, when we deserve the award, we will not celebrate. I did the good work. They gave me the award. What is there to celebrate? Get the point? People who got it by shortcut only will celebrate. People who genuinely worked for it and they got the success will not celebrate. They will only keep thinking of what next and how much bigger what all we can keep on doing. Because for them, success is a journey. It's not the end point of career or the particular task. Why I am telling this is because the moment you think that salary is there, I am working, why to do online? That extra thing you are not doing, that means you are going to be just among everybody else. Whatever extra sincerity you have inside you, You are trying to show 9 to 5, you are trying to show Monday to Saturday, it will take you nowhere. Trust me. So point here is, you have to reach to people whom you don't know. Be it if you are a teacher, unknown people also should learn from you. Practitioner, unknown patients who are not coming to your clinic also should know about the physiotherapy treatment at least. Imagine if at all in India, the example of number of population, where we have 130 crores population. In that you see how much is the qualified physiotherapists. Members of the Indian Association of Physiotherapists itself, it's only 75,000. What they tell is maximum it can be 2.5 lakhs. Imagine the proportion. And in that 2.5 lakhs, how many are in India? Maybe 1.5 lakhs may be in India. 1 lakh will be abroad. They're very clever. So these 1.5 lakhs people, how they will reach to the 130 crores? 10 years before, 20 years before, or 30 years before, previous generation physios have seen that physiotherapy awareness among the public is very poor. Again, this generation which is now passing out also is feeling physiotherapy awareness is poor. After another 30 years, the subsequent generations also will feel the same thing, that physiotherapy awareness is poor. What is the point in feeling if you are not doing anything in action? Is it not the responsibility for every physio to promote a public awareness? People think that physiotherapy means it is only massage. Physiotherapy means it is only that what is called as doing movements like this. In Hindi it is haath pair hilane wala, malish wala. It's very depressing, sir. How many advanced things are there? People are not knowing anything. Hey, what you did to make them know, man? Did you teach them? Did you release at least one video per week? YouTube channel, signing up or signing in through your Google account, Gmail, everybody has. That signing in takes hardly half a minute. And after that, creating a channel is another half a minute. And after that, putting a video, I already mentioned. 5 minutes videos you put. What is physiotherapy? Who is a qualified physiotherapist? What are all things to be done? If you are visiting a physiotherapy clinic, means what all things will be done? If you are having neck pain, what all will be done? Put 5 minutes video. Let the patients know that genuine physiotherapy means they will do evaluation and examination. They will not give the treatment directly, because genuine physiotherapists consider themselves as clinicians, not as technicians. Okay, your video only 10 people only is watched. No problem. You will see after 1 year how many people are watching your videos. It is your responsibility. You cannot expect that others are not watching, so why I have to do? If I am thinking like that, whenever I am taking webinar every day in this Facebook page, right here in this platform, we never had more than 15 people watching me live. So 15 people also not watching if I stop talking or taking the free webinars. But you see the reality. There are videos with 1500 views. There are videos, all the videos are more than 500 views. Some people might watch it at their convenience, some will watch it later. Don't get motivated by the participation of the people. Get motivated by your purpose itself. My purpose. I have to do that. I have to go beyond what is there every day. Why? Very simple. In bottom line, you are doing marketing for yourself. As a clinician also. Online presence, educating the public, will make the public to take appointments from you and come to your clinic for consultations. This best example what I can tell is about coccydynia. I had published one of my first and the earliest videos which I published in YouTube is the Maitland's mobilization technique for coccyx in coccydynia. It was published before 15 years. That video has crossed nearly 1 lakh and more than 1 lakh views. Very short video. It is hardly 2 minutes or 2.5 minutes. Or even less than that. But you see that people have asked my mobile number and they have fixed appointments. They have come and taken treatment from me. Not only when I was in Manipal, not only when I was in the Delhi NCR or the northern part of India. Even now people are contacting me for coccydynia from that 3 minutes of video. And I ask the patient, which city you are? Would you prefer to travel or you are comfortable with another therapist you can take nearby? Then I give the name of our AOMPT core committee member, tell the patient to contact, and I also inform the therapist that I have given your number so that you can treat. At least I am able to connect the adequately trained therapist with a motivated patient who is trusting that physiotherapy will help me. Because these patients are told that you have to get operated for coccydynia. They don't want to go for surgery. If they have to come to Bangalore, and I will treat only people who are in Bangalore, I am not a physical therapist. I am a Bangalore therapist. Understood? You are not getting Bachelor of Physiotherapy, you are getting like Bangalore Physiotherapy. It is ultimately silly attitude to the core. If you are happy with the everyday happenings. All these people have suffered immensely during the lockdown when no patients were there in their clinics because clinics were closed and they were not able to pay the salary to the subordinates. Neither they were able to even manage their own family. It's a very unfortunate scenario because none of the clinicians ever thought we have to do online consultation and online treatment, which is broadly categorized as the telemedicine if it is to do with the mainstream medical practice, Telerehabilitation when it comes to all the therapies under the allied health professions. Maybe a speech therapy, maybe occupational therapy. Of course, all our medical treatments, the opponents of or the critics, they are very happy to tell how a treatment which is a medical treatment can be given online. Yeah, this is the first and important question. But then you know the reality, COVID has answered all those critics with a big smile, telling that whole life you will be online only. Food is online, shopping online, consultation online, treatment online, education and degree also online. Most importantly, physiotherapy itself. The final year students who had given exams in 2020 and 2021 are very well aware that the COVID batch passing out students, be it bachelors or masters, all are aware that their classes were only online and they gave the exam also without practical exams. And they are happy to be clearing the exams. That is a different issue. Entrance exams are conducted online, but never the final exams were conducted online. Right. So, it's important to recognize how actually we can stay ahead of time. That means we have to think futuristic. But now COVID has taught us that no need to look into the future. See the present. Are you happy with the case load in your clinic? What is the problem? Many patients did not take physiotherapy during the lockdown. Many of them, if they had frozen shoulder or they had a chronic degenerative joint disease of knee or they had a back pain, these patients or even post-operative patients also, those who are regularly taking physiotherapy before the lockdown, the moment the lockdown came, they started experiencing their life without physiotherapy. And we all know we prescribe exercises, home program, but the patient cannot do only the home program and lead to an improvement. Home program is only for maintenance. You treat today, patient comes tomorrow. You want that today's improvement to be maintained for tomorrow, at least 60%. That is why home program is given. If therapy not there, with only home program, nobody can improve. And over a period of time, the compliance to exercises reduces. Whatever you tell them to mark in the patient diary, exercise diary, date wise, time wise, I have done this exercise, tick mark, all that. It is very tough for the patients to continue with the exercise program. Only athletes, they have that motivation to keep on working. Younger generation who feel like their body shape is very important cosmetically, they might also be doing gymming or the resistance training. They won't stop working out because for them the appearance is very, very important. It's not for fitness. Fitness means it's treadmill. Fitness means cardio workout, which is like a general walking. People don't want fitness. People want that attractive looks. So that is why they do the resistance training. And when people do the resistance training without the cardio workout, they land up to the cardiologist. Okay? How many ever years they are doing resistance training or gymming, they are not going to become fit. And one sudden they'll get a heart attack. Same like what happened with celebrity actors who died at a young age. But they are totally very, very muscular with packs, everywhere packs, 6 packs here, 2 packs, whatever packs. But died at a young age. Why it is important to know all this? Because public awareness has to improve. Role of physical therapist should be highlighted everywhere. If the media is not highlighting, means it is the role of every physiotherapist to highlight their own. See, non-scientific methods or commercially distributed treatments, so much they are publicizing. Okay? Be it alternative medicine methods like chiropractic and osteopathy, or when it comes to the Middle East hijama techniques. Every time they keep on publicizing, putting the picture with the cups and then the blood is there. Big achievement. Okay? They keep on publicizing so much. So don't you think that being part of mainstream modern medicine, being such an advanced profession with a lot of research, and we are proclaiming ourselves as movement scientists, physical therapists need not do anything to reach the online platform? If you don't do anything to create the awareness, don't blame that the public do not have the awareness. You make the effort, keep on making the effort. Don't blame others. People are learning or not learning, it is their wish. Your duty is to teach. People are taking the treatment or not taking the treatment, it is their choices. Your duty is to create the awareness about treatments. Right. We see the pros and cons of Telerehab. As I was telling that, Telerehabilitation is the need of the hour. You have to know this. You have to get your whatever camera consciousness, get out of the door. Okay, push the camera consciousness out and you have to sit in front of the camera. Because you are thinking that the third wave and then fourth wave it will get over and all those things. Okay, people are telling that Omicron is very mild. It might be the end of the COVID and other things. Just see the reality, what happens. Okay, if at all you can come back to this video in 2030, 2040, 2050, come back to this video, you will still see that this professor, who is the chief instructor of Academy of Orthopedic Manual Physical Therapists, told even 50 years or 100 years also, COVID will never disappear. Mark it again, COVID will never disappear. Because it is a mutating virus. Vaccine, RNA vaccine. Mutations are lifelong. Greek letters will become shortage. Alpha, beta, delta, Omicron, omega, whatever. But the variants will never reduce. We don't know which one will be seriously impacting the population, which one may be mild, which one may be detected, which may not be much detected or tested. Not only this COVID, I am not talking negatively. What I am trying to tell is, if it is a natural virus, it is part of the nature. Nature has its own way to keep its organisms alive. Humans, we are there living. Sudden earthquake comes. Our colleagues in Indonesia, our partners, I was taking the webinar. They got an earthquake there. Suddenly I am seeing all the chairs are empty. And they are telling me in voice call that they had an earthquake. It's a regular happening for them. Many places volcano eruptions. Many places the floods and the tsunami, the cyclones, landslides. Every type of calamity happens, whether natural or man-made calamities. But still, human beings are surviving. That is the evolution. Same way everything will be evolving. You cannot eliminate a virus because it is part of the nature. If it's an artificial virus, it can be destroyed. Because it is created by man, it can be destroyed by man. A natural virus which the nature has created, man cannot destroy. So only variant it will be taking to survive. Okay, then the virus also has its survival instincts. So it will be doing that. If not inside the human beings, it will go inside the animals and it will try to survive. If not, it will go inside the plants and then it will try to survive. This scenario came in China, where they reported that fruits and vegetables have COVID virus. Just check it. Be aware. How, for example, how can I know this? It's only online. We are learning so much from online. We are seeing other news websites. We might see YouTube channels. We are learning. Is it not our duty to ensure that others are also learning from us? I don't think I have to explain more to highlight the role of telerehabilitation. Another important thing is, I am a therapist. I am alive or I am not alive. But my video, which is for public awareness, patients will be watching and learning even after my death. Same thing goes with the teacher who is sharing his knowledge through webinars. He may not be alive, but the knowledge will be alive. Students will be great grandchildren, 4 generations, but still they will be learning from him. This is the technology, the advantage that it has given us. Can't it be utilized to provide best care for people? Another thing, even without the lockdown also, there were many patients who were not able to travel and reach a physiotherapy clinic. Telerehabilitation is not new. Now we are talking in India because of the lockdown and direct access being prohibited for the safety of the public. But the first in the world in physical therapy to evolve telerehabilitation is the United Kingdom. In UK, I remember that it was 12 years before, okay, it was around 2010 that telerehabilitation services started functioning in the NHS itself. And when they did that, they got mixed responses. But their necessity was the number of therapists are less. Patient load is too much. Waiting list is 6 months. A patient wants to take treatment for neck pain. The appointment they get after 6 months. Meantime, they will be like, neck pain will become full body pain. Or neck pain will become headache. And they might forget also. Their purpose was different because the professionals were less in number. But still they were successful because everybody need not be coming to the consultation to the clinic. You send the questionnaire, screening questionnaire, subject answers online, telephonic consultations, giving them basic level of prescription, activity modifications or exercises. So those who don't respond with that basic intervention, they are alone were given direct consultations and appointments. So geriatric or terminally ill, all these people utilize this benefit. And there have been lot of research comparing telerehabilitation with and without telerehabilitation, what happens, telerehabilitation versus actual, lot of things. And as physiotherapy community, we are aware that UK has been the leader. What? Truth is that only. Because in education, Australia is the leader. in the world, physiotherapy. In income, practice, the scope, US is the leader. Okay. Then UK, what is leader? It's not the earning, or it is not the learning. It is the change that you make in the profession. How you are taking the profession forward, you are developing the profession, that is the leader. Prescription by physical therapists for drugs, UK. Everything they have been a front runner. Of course, they have the liberty that the World Confederation of Physical Therapy, which was formerly called as the WCPT, now which is World Physiotherapy organization, is located in the UK. So they make any policy changes, immediately the Chartered Society of Physiotherapy will tell WCPT has done that, so we have to follow. Both are same people only. It's like I am part of CSP, Ritu ma'am or Darshana are part of WCPT. Okay, my core committee for the AOMPT. So it's so easy because they are all in the same place and they are bringing about the change. Most importantly, they are women. If women physios decide that they have to promote the profession, nobody can stop them. In India, women physios are only concerned that how can I come live on YouTube? Okay? Even in the Zoom when they are attending, they are not comfortable to come on the screen. Women physios. But with due respect to the women's cell of the Indian Association of Physiotherapists, they kept a competition. Not lecture or paper presentation competition. They kept for dance competition. Okay, they kept fancy fashion show competition and all that. Singing competition, all that. For that, these physios have to send videos. And you see the number of entries in the women's cell Facebook page. Videos you go and then you see all physios are dancing. Okay? They are not conscious to dance, and they are not conscious to share a dancing video in the Facebook page there. But the same physio tells coming on YouTube on video and all, they won't allow in the family. Okay, I trust you. In Tamil there is a saying, childhood itself they put a hole in my ear. Okay, so don't try to cheat me. Why I am telling this is because for entertainment purpose, women are coming online and they are releasing the videos. Why can't you come for education purpose? Why can't you come for public awareness? If your parents or in-laws are not permitting you to come online, means take a video and show them. This is what I have to upload. See what is wrong in this. Why I cannot come? I am a teacher. Why I cannot put a teaching video in the YouTube? Talk to them. If you want a silk saree means you are convincing them for 1 week to purchase that silk saree. Why can't you convince them for uploading a video, teaching video in YouTube? You cannot convince your parents and your in-laws. What stories you are telling? Women, you are your own enemy. Nobody else. Our profession is dominated with women. But all these women don't keep the profession as the first choice. They are not keeping. I am not telling ditch your families. But it is your responsibility to make your families understand. If they are not cooperating, then who is going to cooperate? You are the boss in the house. You are the homemaker. If they don't agree to your wish, means you can do anything in the house. What way you can think that it's I cannot put a video in YouTube. I cannot come on the screen in Zoom. I am very shocked to listen to even teaching faculties who are telling that my in-laws don't permit me putting the video in YouTube. Recording a video and watching for yourself, it is your self-review for your own improvement. But uploading a video for everybody and their comments will really boost your confidence, because a person from France is appreciating you. Physios from Philippines are doing my courses. Patients from different countries are contacting me. Is it not giving you a fulfillment that I graduated a degree from India and the whole world is taking treatment from me? The whole world is getting education from me. Won't it give a fulfillment for you? Is it not your responsibility towards India? Your mother country, your flag of your country flying high, because you have knowledge, because you have skills. Can't you do that for your country? You only want to do only for your salary. Even then also, you think that the international market, they will ask for free treatment. Only Indians will ask. Sir, if treatment is free, you tell me, I will come. Sir, if a webinar is free webinar, means you tell me, I will attend. Indians will ask. Internationally, very few countries. I have got experience of this. Pakistan, some from Bangladesh asking that free webinar like that. Otherwise, you see, even Sri Lanka physios, they openly ask, how much is the fee, sir? Fee is this much. Okay, anything you can negotiate, anything discount you can give, sir. We are low economy country, so can you give any discount? No problem. How much you can pay? Okay, do it. I just give it. They don't ask for free webinar. Free doing is your responsibility, because it is part of your charity. Okay. What I am trying to tell is, international clientele is there, means they are going to pay you in their own international currencies. Always remember that your income is going to improve only by Telerehab. One, because other than the patients who are visiting your clinic, even those patients who are at their homes also, or other than those who are in Bangalore, anywhere in India, anywhere in the world, that means you have scope for larger number of people to take consultations. The most interesting thing here is, you need not charge the same fee what you are doing for a regular therapy, but you can do lesser also, but still the number of cases are more. If you are giving appointments like 10 low back pain patients, give them a time slot, 7 to 8 p.m. In that they will come live on the Zoom. You will demonstrate the exercises. They will watch and they will do the exercises at their own places. When they are performing the exercises, you should not be doing. You have to sit and supervise on the screen. You have to see how they are doing each one. Okay. Or you can even tell, like, first, yes, Ritu ma'am, do the exercises, I want to see. Okay, now Ritu ma'am completed. Okay, now Darshana ma'am, please, you do the exercises. Okay. Joby, you are watching na Darshana and Ritu ma'am doing exercises. Yes, right? Okay. So be careful. Okay, you should not do that much as what Darshana ma'am did. You have to do this lesser. Okay. Don't bend so much backwards. Okay, I can tell like that. Obviously, people can do that. And when he is doing also, you can tell, enough, stop there. This much enough. Don't do more extension of the lumbar spine. You can directly tell that. In video chat, lot of things we tell. How? Cooking classes. I'm always fond of these cooking classes. Recently, in the past 3 months, someone tells online, someone is telling on TV, you watch that and you start cooking, something comes and you are eating, na? Online cooking classes is possible. Online for psychological counseling, okay, that is also possible, like problem solving, what is called as motivational counseling, all this. Why not online? Even medicine prescription, they are taking verbally, okay, these are the problems, here is the pain, okay, show your area, okay, did you get any fever, are you feeling any difficulty when you are chewing anything objects, do you feel like any change, any hearing, any problem, anything here, nothing, na? Okay, take these tablets. Telemedicine. Don't we as healthcare professionals know which techniques are safer in Telerehab, which techniques may not be safer in Telerehab? I am not telling that thrust manipulation has to be given. So I will show on the model here thrust manipulation and ask the caregiver of the patient to perform the thrust manipulation, and I see through the camera. That's ridiculous. You know that there are disadvantages of thrust manipulations. The precautions are more than the indications. Even the contraindications, whatever, they are more. So such techniques you are not going to use in the Telerehab. Obvious. Will you tell, I am doing the needling, tell the caregiver to take the needle and put it on the patient? Never. You know that it is having lot of adverse effects. More than the positive benefits, hazards are more. You are not going to tell Telerehab via dry needling. So don't think about what is not possible. There is always a contraindication for list of things which you cannot do via a Telerehab. Like surgery. A surgeon cannot operate online. Understood? But a physician can definitely give the consultations. Any surgeon, they cannot operate online. Okay? But now robotic surgery has come. Maybe in future, I can fix the appointment. The robot will come. It will do the dental surgery for me and it will go back. Okay? This can come in another 5 years. This is the trend which is going to happen. So, remember that we can do every evaluation in Telerehab because all our assessments are physical examination. We are not utilizing expensive gadgets for examination. An X-ray, you cannot take an X-ray of me through the camera. Okay? But maybe in another 10 years, there might be an app which can come that now itself I think there are some paid apps. You take a picture, photograph of yourself, it shows you as an X-ray. But it may not be the actual my body X-ray, it is just schematically showing attractively. Okay, like a skeleton, all that. More scientifically also it is going to come definitely. These things are part of the scientific development. We are not using any expensive electronic gadgets. We rely on hands. We were telling when we have to do everything with hands means how it is possible through the camera. Very simple example. I am also going to go break all the barriers and we are going to conduct a separate course. Certification course. Certified Telerehabilitation practitioner. Why? Because colleges do not teach students how to perform telerehabilitation. Workshop resource persons, those who are directly taking the workshops, don't know how to take online courses. I am not training workshop people online one, but at least the therapist should be able to do a telerehabilitation. So in this aspect, I am showing one demonstration, for example. My hand. You can clearly see my hand. This is my left hand. You are telling most challenging thing is palpation. Okay? Because in physiotherapy, hands-on means touch, identifying bony landmarks. Okay? This is the only major thing which is actually a challenge. Okay? Soft tissue diagnosis with the palpations to give even treatments. I'm telling this example, one short example. Okay? You can do it for every aspect of physiotherapy. In fact, the 3 hours masterclass course, certified telerehabilitation practitioner, 1 hour orthopedic conditions, 1 hour neurological conditions, how to do telerehab, and 1 hour is cardiopulmonary, how to do the telerehab. Right. So, I have multiple options. I can either demonstrate on myself, or I can have a model here and I can demonstrate. Patient is watching with the caregiver. As I was having an experience with the Indonesia webinar, the fasciomuscular release, I was talking in English, I took a break, then the local host was translating in the Bahasa Indonesian language. So that means I have to give breaks in between. The moment I do something, I have to watch what they are doing, whether correctly they are doing. Immediately I should give. I should not be continuously doing and telling them to continuously follow me. No. Okay? You do only a 20 minutes treatment, it might take 1 hour. Even 15 minutes treatment might take 1 hour in telerehab, because more effort is made to ensure that the person on the other side of the camera is doing at least 75% of what you are demonstrating, and doing within the safe limits so that there is no injury or there is no any adverse effects. So bony landmarks. I can tell the patient to hold the wrist. I don't think any patient will have a difficulty in holding the wrist. Okay, everybody knows what is the wrist. If I show like this, they can also hold like this. And then I tell them that below the thumb you feel that bone. Okay, this is one bony prominence. And the same way you run your finger, little finger side another bone is there. So these two bones, I need not tell them that this is radius or it is styloid process of radius, or this is ulna and the ulnar styloid process, because that is anatomical terms. So there is a bone which is below the little finger, there is a bone which is below the thumb. Landmarks done, palpation. You can also confirm whether they are holding the same, because they will show their hand like this. You will tell, no, your thumb is not in the correct position. Just move it towards the little finger. Okay. Are you feeling that hard area there? Yes sir. Here I am feeling. Yeah, correct. Okay. See, skin itself you can easily find. This one only. Yeah, you are correct holding. Okay. So correct it. And next, when it comes to touch. Okay. Just touch and then move the skin. Okay. Other person also can show that no, this much pressure don't do, because you can easily see here there is more pressure. Understood? Here means touch. There's a shadow. Here you see that it is, the shadow has gone in together. So it is, pressure is there. Visually itself you can see everything. See, one thing I will tell you. Eyes only see what the mind wants to see. If your mind do not want to see means, you will tell it's not visible. Nothing is clear. Don't give lame excuses. Pardon the first interruption. Easy? So I show like this. Do this. Okay? Patient is showing this. Can't you see the difference? Here my watch is moving when I am doing this finger, and you know pressure is more. Here watch is moving. Here only skin is moving. Even the bracelet is not moving. You understood or not? Can't you see that this is fascia? Because fascia gliding will create movement of the next segment. This is the joint. Below the joint I am doing something, and it is moving the part which is above the joint. So that means it has to be fascia. Whereas I am doing a technique below the joint, it is not doing anything to the segment which is above the joint. That is only skin. So skin movement versus fascia movement. Whoever has seen this the past 2 minutes, your conscience will tell that no academy can teach this online effectively. So for a scar mobilization, whether you want to mobilize the skin or you want to mobilize the fascia, can't you tell this in Telerehab? If you are a human being, you can do that. So please do not give excuses. And if you don't know how to do Telerehab means, AOMPT is there. Join the course. 30th January, Certified Telerehabilitation Practitioner. Do not miss the opportunity. Because it's not just the course alone. The recording of the course, you are getting lifetime access. And future consultations. You have clarifications or doubts when you are with patients. Telerehab how to do. Or with the patient, you are there in Telerehab and you want me also to come and contribute. All three of us online. With discounted fees. Because every patient consultation there is a charges. Okay? But that will be discounted for people who have got the Certified Telerehabilitation Practitioner. So remember, those who are thinking that even AOMPT, how it is teaching manual therapy online, you had got a sample now that we mean what we actually do. What we do only we say. Right? And ensure that India sets a bigger example in telerehabilitation. We have huge population who cannot reach, who cannot travel. We should utilize technology and ensure that we can remove the barriers and improve the healthcare status of the population, the largest number of population. At the same time, widening your scope of practice, establishing a global market for your therapy, branding your clinic. Because we were talking about entrepreneurship in the previous professional development webinar series. So telerehabilitation is a very, very important aspect to know for everybody. I am talking on behalf of an academy which is the only academy in the world to have provided more than 1,500 hours of online manual therapy education. No other academy, no other foundation, no other association in manual therapy in the world has provided this much online manual therapy education throughout the 2 years of this lockdown. So if manual therapy could be taught online, and if any academy name has to come, it is A for AOMPT. So remember, the whole world knows that. Do not narrow down the scope of your practice by your negative attitude. Make sure to learn from the people who have positive global outcomes. Okay, so good luck to you all. Opening the session for interactions, and as every one of you will bring points to discuss, we can have more what is called as a brainstorming. Okay. कतनी और करनी एक है. कहनी, कतनी. I don't know Hindi. Okay. Written Hindi, it's very tough to understand. Ritu ma'am always spontaneously talks in Hindi. So, Adi Boli means in Malayalam it is. Okay. So what I am trying to say is, we all need to make a better world. Even consultants, two physiotherapists can be together. One might have been a very experienced therapist or an expert therapist. Another therapist who is a junior therapist. And the senior therapist can give suggestion to the junior therapist through Telerehabilitation. In reality, directly the expert traveling, going to that location, logistics, imagine, it's not possible. But Telerehab gives such an opportunity. Even if one single patient has to get opinion, they are having a kind of a movement abnormality, they are not improving much. A group of 10 physiotherapists can see them together at the same time, and then they can have a group consensus what could benefit the patient more. And the patient will feel that for my welfare, 10 doctors are discussing and they are telling me this. So I should do my best to improve and become normal. Remember, it is all that we should work together for the welfare of the patients, work with each other, and ensure that at any cost the name of our country comes above everything else. Do not see your individual differences. See only that India should be the leader. Right? So good luck to you all, and your enrollment in the course, the Certified Telerehabilitation Practitioner, is always the most welcome initiative and the most important transformational step that you can take in your professional career. Registration is now open. I have done the first announcement today. So not miss this course and be the best as a physical therapist, as a human being, and also as an Indian. For those who are not in India, don't worry, be for your country. Okay? But being for humanity at large is the responsibility of every human being. God bless you all.